Gynies. I'm happy that you could join me for today's COVID-19 update. I am Dr. Artenisa Hamilton, Director of Primary Healthcare Services, and I will first provide you with information on the local situation over the last 24 hours. Yesterday we reported 7 new cases, and today, sad to say, we are reporting yet another case, bringing the total number of positive cases to 125. I'm quite sure that you, like me, are very worried about our numbers which keep climbing. As of the 18th of May 2020, of the 51 tests done, 1 was positive. The total number of persons tested to date is 1,269, with the total number of negative cases being 1,144. We currently have 46 persons that have recovered. Recovered cases refer to persons who were affected with the disease and who now have been cleared with 2 negative results 24 hours apart and no signs and symptoms of the virus. These individuals can no longer infect others. However, they can be reinfected if they do not take precautions. There are 69 active cases in institutional isolation, 3 patients in the COVID-19 ICU, and the number of COVID deaths remains at 10. Fellow Gynies, each day our frontline workers, inclusive of the staff at the National Public Health Reference Laboratory, are working under duress, either testing persons for the disease or battling to save the lives of those stricken with COVID-19. We cannot find enough words to express our praise and appreciation. So I appeal to you that even as we applaud the untiring efforts of those faithful workers, that we think of our actions that are contributing to the rise in our numbers. Unless we change our behaviors, not only will our numbers increase, but our return to normalcy, our fellowship, our social gathering, our hanging on the seawall will be unnecessarily long and stressful. Globally, the statistics according to WHO are as follows. The total number of cases is 4,618,821, with 311,847 deaths. In the region of the Americas, the total number of cases is 2,017,811, with 121,609 deaths. As we reported yesterday, the vulnerability of Guyana to have imported cases from neighboring countries increases every day. In neighboring Brazil, the situation continues to escalate. As of yesterday, the number of deaths has jumped by 816 to 16,118, emphasizing how vigilant and responsible our residents in Region 9 must be in order to keep the virus out of our bordering communities. We can no longer continue to traverse the borders to conduct business as usual. Safety and staying healthy must be your watchwords. Today we have with us Ms. Nataline C. Prasad, medical technologist attached to the National Blood Transfusion Services, who will be speaking to us on the importance of donating blood during this COVID-19 pandemic. Merci, Prasad.
Thank you, Dr. Hamilton. Ladies and gentlemen, I am Ms. Natalie Prasad, Chief Medical Technologist from the National Blood Transfusion Service, and I'm here to share with you the importance of donating units of blood, especially in this COVID-19 pandemic. As the COVID-19 pandemic continues, the National Blood Transfusion Service applauds those individuals who have selflessly responded to the call of blood donation during this time. Since blood has a limited shelf life, the need for blood always exists. The need for blood donations from voluntary donors will remain throughout the pandemic to continually replenish the blood supply and ensure the availability for our patients in need. The National Blood Transfusion Service faces a critical situation where a multitude of our blood drives are being cancelled as organizations and businesses temporarily close or have staff on scheduled rotation. It is important to emphasize that the need for blood remains essential during the pandemic, as countless patients across the nation will continue to rely on blood donors to help provide a life-saving component for sickle cell patients, thalassemia patients, and patients who require major surgeries, and high-risk pregnant mothers. Many may ask, is giving blood safe during a pandemic? Please note that protecting the health and safety of donors, patients, and blood bank staff remains the top priority for the blood transfusion service. Measures are in place at the blood bank and blood collection sites that are designed to provide the highest level of safety and infection control. In addition, blood collection sites throughout the country are taking extra precautions to help ensure safety of both blood donors and staff, some of which include implementing social distancing practices between donors, furniture, and equipment, increasing the frequency of sanitizing for all surfaces, equipment, and common areas. Ladies and gentlemen, please remember the National Blood Transfusion Service is located at Lamaha and East Streets in the Georgetown Public Hospital compound, with other collection sites at Suddy Regional Hospital, Region 2, West Demerara Regional Hospital, Region 3, New Amsterdam Regional Hospital, Region 6, Lethem Regional Hospital, Region 9, and Linden Hospital Complex, Region 10. If you wish to donate blood, please contact us on telephone numbers 223-7182, 225-7249, or 226-9022. Do keep in mind that 1 unit of blood can save up to 3 lives. Remember, bleed for all things that matter to us all. Thank you.
Thank you, Ms. Prasad. I do hope that the information provided was useful and that our regular blood donors, as well as those who have never donated, would respond positively and go to the Blood Transfusion Services Department located in East Street and donate this life-saving fuel to save the lives of our brothers and sisters across the country. Fellow Guyanese, yesterday we launched a new communication tool in our COVID-19 response, the Quintin Quarantine Quartet, in an attempt to raise awareness on the challenges our families are facing during the COVID-19 crisis. The Quintin Quarantine Quartet explores those challenges, and we hope that you can use these coping mechanisms and strategies in the long periods of staying home together during this pandemic. I hope those of you who have watched the first episode enjoyed it. Please join us at the same time, the same place, next week for the second episode. I wish to remind you that Guyana's health is in your hands. Don't be selfish. Don't be unkind. Think of our fellow humankind. Stay home. Keep your distance. Continue to save lives. Thank you.